Hi, my name is Trinh. I've been a hygienist for 30 plus years, and I love to be able to offer different cosmetic solutions to our patients, whether it be a little change or a dramatic change. It's always wonderful to be able to give patients the option and be able to help them reach their dental goals. Bonding and veneer is really just a matter of material. Sometimes also the preparation. So a patient is looking to transform their smile. We really want to be able to assess what their goals are, how quickly they want to get it done, and obviously the cost of the investment and time that's involved. So the difference between a bonding material and a porcelain veneer is quite different, and the cost is quite different, and then the longevity of the both materials are quite different. So we always want to check in with the patient and be able to see what their goals are so that we can be able to advise them and guide them in the path that's best suited for their dental goals. If a patient's on the fence of whether they're thinking about doing dental bonding or long-term permanent veneers, I always tell patients, what are they looking for? Something right now or something that's going to last a long period of time. And it's also time, because with veneers, it does have a certain type of steps that involves a lab that we use. So it's really important to understand the time frame of the patient's desires, and also the investment that they want to make in their smile and the longevity of that. And that really helps me to be able to guide them in a path that's best suited for them. There's different ways that I would say I would advise a patient, whether it be bonding or veneers, is really how much tooth structure they have, what's their existing dental health. Sometimes with bonding, it's better to have when you have a lot of existing dental work, because bonding, we will be able to do more bonding on top of the existing dental work. Veneers is a little bit harder to bond on teeth that have had existing dental work on. So that's why when we're assessing the patient for that initial cosmetic consult, we take that all in consideration so that we can make sure that, yes, they may want this, but this may not be the best solution because of the limitations of the preparation of the tooth. The time commitment between bonding and veneers is quite different. When we're bonding someone, we're doing that same day. We're preparing the tooth by tooth, but the dentist is crafting or reshaping that tooth individually same day, and the patient is left with that bonding permanently done within that same visit. With veneers, we're preparing the tooth, we temporize it, that tooth gets permanently made with a massive ceramics through a lab tech, and then they would have to come back for us to do to really permanently place that veneer in. So it is a little bit of a time commitment in terms of the difference between bonding and veneers. A patient can definitely start with bonding if they're thinking about changing their smile, but not necessarily having the time or the cost commitment in doing a full case of veneers. And we see that all the time. I tell you, it's like a kind of a gateway step into cosmetic dentistry, because when we prepare a tooth for bonding, it's usually quite similar to when we prepare the tooth for veneers. So you're not locked into only picking but bonding at the time and doing veneers down the road. That's definitely possible. Again, it's all takes into consideration what your existing dental work looks like. But for the most part, if you are a good candidate for bonding and veneers, and you do bonding first, you can absolutely be able to transition into veneers down the road. The common misconception about bonding and veneers is that people think it's also something that you grind the whole tooth down like a dental crown or a cap. So veneers is kind of a universal term for a small makeover, whether the patient had crowns, a mixture of crowns and veneers, or a mixture of crown, veneers, and bonding. Anytime when someone sees a smile that's been transformed, they just refer to it as that person had veneers. And so a lot of misconception is that there's a lot of grinding of the teeth down, or you're going to be grinding down to nubs. And that's not necessarily the case when you're dealing with bonding and veneers. Now, sometimes when we're doing a crown, the tooth does need to be prepared down a little bit more, but that's completely different. So if we're really just speaking about bonding and veneers, that's a very conservative preparation, and you're not left with just a nub of a tooth. If you're unsure about what type of cosmetic procedure is best suited for you, whether it be bonding or veneer, the very best thing is to come in to schedule for a consultation. That's where we're able to really take photography, x-rays, do a complete scan so that we can be able to not only see what your front teeth would be transformed, but also how it harmonizes with the rest of your mouth. Because keep in mind, your teeth, even though we're really dealing with a lot of small type teeth, where that is still attached to a whole working mechanism called your mouth. So we do take that in consideration to make sure that when we're altering the shape and the size and the coloration of your front teeth, that still has to work in harmony with the rest of your mouth. So having a really thorough consultation, whether it be a cosmetic consultation or a comprehensive, dental health consultation, we do it all the same.